Okay, I think folks are still joining, but I will get us started just with some housekeeping notes. Hi, everyone. Thank you for coming today. My name is Taylor. I'm an admin coordinator at CLS in the Health and Independence Unit. I put all these in the chat, but just some reminders for today. First of all, this webinar is being recorded. All attendees are muted and your cameras are off for the duration of the presentation. There's no chat function enabled for attendees today. However, the Q&A is open. So you can submit questions and we will answer them throughout the presentation. You can also upvote questions by clicking the thumbs up icon next to a question if you see that someone else has already asked a question that you also want to ask. We possibly or probably won't get to all of the questions today, but we will send out a follow-up email that will answer the questions that we didn't get to. Closed captions are available for this webinar. So if you look on your Zoom toolbar, you should see an option that says show captions. And lastly, after the webinar, we will send out a follow-up email, and that will include, as I said, a recording of the presentation, the answers to the Q&A, and the slides from this presentation. We will be sending out the slides from the presentation. Okay, today we will be hearing from Louise Hayes, attorney at Community Legal Services, Ann Sanders, who manages the SNAP outreach program at Just Harvest in Pittsburgh. And we also have Mackenzie Libby here today, who is an attorney at CLS, who will be answering some questions in the Q&A as well. In addition to this webinar today, we also have several more upcoming webinars on related topics to this one, and we will share more about those in the chat and at the end of the presentation. I think that's everything from me, and I will pass it over to Anne.
Thanks, Taylor. All right, so we can go to the next slide. And I'll just go over the quick rundown of what we're going to be talking about during this webinar. So first, I'm going to just quickly talk about what's going on with SNAP and how things have been going since HR 1, the One Big Beautiful Bill Act, passed, the immigration rule changes, and the work reporting requirements that have changed. And then we'll talk about lessons learned for the upcoming changes for medical assistance. So we can go to the next slide. So I'm just going to talk a little bit about what's going on with SNAP. We can go to the next slide. Sorry, I like short slides. So since HR 1 passed in July of last year, that was the steepest cuts to SNAP in history. Most of those cuts took effect in the fall of last year. Since then, we've seen a more than 10% decline in SNAP participation across the state, more than 200,000 people that have lost connection to SNAP benefits. And this is also impacting children, even though children are exempt from the work requirements, an 8.7% drop in child participation across Pennsylvania. These cuts are caused by the changes to immigration eligibility rules, which I'll talk about shortly, and the work reporting requirements, as well as extreme pressure on the state to reduce payment errors. We can go to the next slide. So one of the changes in HR 1 was that there's a upcoming in October of next year cost shift delay where the state is on the hook to pay some of the benefits, a certain percentage of SNAP benefits as part of the program. And it's based on our payment error rate. So right now we're looking at, between $400 and $600 million annually that the state might need to cough up to keep the program operating starting October of next year. HR 1 sort of set up all states to fail. They reduced administrative costs sharing, and added complicated rules that require more administrative costs. And so our error rate is not really improving, even though the state is trying as hard as possible to make that happen. What we're seeing is more scrutiny for all cases to make sure there's no errors, but there's just not enough staff really to do the work. And the way that the payment error rate is measured, it only counts faulty approvals. It only looks if there's a payment that went out. So if someone is wrongfully denied or their benefits are stopped wrongfully, that doesn't count as an error for the payment error rate. So they're not penalized for that in this like hefty fine that we're looking at starting next year. It's only looking at folks who are approved and if their benefit amount is incorrect. We can go to the next slide. So the immigration rule changes, there were lots of changes that went into effect in the fall. We can go to the next slide. Um, these are similar but different to the new immigrant eligibility restrictions for medical assistance. These are actually more strict than the medical assistance ones. So starting in November of last year, families that are applying or renewing their SNAP benefits, these impact those folks. So we're still seeing some people be disenrolled from the program because of these rules, but most participants who are no longer eligible have already been unenrolled. So VAWA petitioners, asylees, refugees, special immigrants from Iraq and Afghanistan, trafficking victims, and parolees are no longer eligible for SNAP benefits. Only these three categories of non-citizens are eligible. So some lawfully permanent residents, there's still a 5-year bar in effect for those folks. Cuban Haitian entrants and Compact or Free Association migrants. So those are the only statuses that are still, and of course, U.S. citizens and nationals are eligible for SNAP benefits. And we can go to the next slide. And so it's still really, really important for folks who, have transitioned from one of those ineligible statuses to, if they've transitioned to having a green card, make sure the county assistance office knows about it. And if there's a path to applying for a green card, get that application in. We're hearing that it takes a long time from our partner organizations who work on immigrants. We know that it's not as simple as like flipping a switch to get a green card, but it's something important to get started. And for those who are Cuban Haitian entrants, even if they've lost TPS status, they are still considered Cuban Haitian entrants. So anyone who came here as they were granted parole, even if it's expired, or if they've applied for asylum, or if they're even in a removal proceeding, final order, those folks are still considered Cuban Haitian entrants. There's a lot of confusion about this, because they revoked temporary protected status for a lot of folks, but that's the situation. All right, and we can go to the next slide. All right, so switching gears, we're going to talk about the work reporting requirements that went into effect. And I see there's a typo on the slide. Sorry about that. You can go to the next slide. So these went into effect in October of last year. We saw lots of people be disenrolled in January and February. What the work reporting requirements are that in order to receive SNAP benefits for more than 3 months within a 3-year period, adults ages 18 to 64 need to either report an exemption that they're working 20 hours a week, participating in an approved training program, or doing community service. Important to note, the 3-year period resets January 1st this coming year. So some folks who may have lost benefits because they weren't able to navigate the work requirement, they can reapply January of next year. We can go to the next slide. So I'm going to just go through the exemptions here pretty quickly. There are exemptions related on someone's age and who's in their family. So under 18 and over 65 are exempt if they're in a household with a child under 14. If they're caring for someone who's ill or incapacitated, they're exempt, or if they're a member of a federally recognized Native American tribe, they are also exempt from the work requirements. We can go to the next slide. There are exemptions related on if you are already working or recently worked. So if you're earning more than $870 a month or working 30 or more hours a week, you're exempt. This is a little bit different from complying. Exempt means they're not going to pay attention to what you're doing until your next renewal period. So your benefits are safe until your next renewal period. So exemptions are extremely important, even if someone's thinking like, oh, I'm complying, I don't need to worry about it. Showing an exemption is the best case scenario. And then if they've applied for or receiving unemployment benefits, that's also an exemption. And then if they're at a recognized school training program, they are also exempt from these work reporting requirements. There are separate work rules for students that may apply, which is important. But okay, we can go to the next slide. If someone is homeless or expecting it to be evicted within the next 14 days, that's an exemption. Domestic violence that impacts someone's ability to work is also an exemption. And then in Pennsylvania, we also have if someone has a long commute, so more than 2 hours to get to a job or training site, that is also an exemption. And we can go to the next slide. And this is the big one is health exemptions. So if someone's getting a disability benefit, they're exempt. It's not just Social Security, a disability, or SSI. This can include workers' comp or short-term benefits as well. If someone's having a hard time, they can't work because of a mental or physical health condition, they are also exempt. This is the only exemption that requires verification all of the time. And there's a form that I'll show you in a couple of slides that people can fill out. Almost all the other exemptions can just be claimed verbally or by using the questionnaire that I'll also show you in a little bit. And pregnant or in a substance abuse treatment program, those are also exemptions to the work reporting requirements. And we can go to the next slide. Okay, so how to report an exemption. So what we recommend is that you check exemptions for check all of the exemptions. Don't just stop at like, oh, they're getting unemployment benefits. I'm not going to ask any more questions. Ask all of them and report all of them to the CAO. They can be reported in writing or verbally during the interview at application and at renewal. Strongly recommend putting it in writing just to make sure it gets in the notes and that's in the case. They can complete, there's a questionnaire, it's linked to in the slide, but I'll show you it in the coming up slide, that they can submit and upload to Compass, or they can mail or fax or drop it off to the county assistant's office, or they can call and verbally report it to the customer service center number. And if they're exempt based on health, they do need to also get that medical exemption form completed by their provider. And we can go to the next slide. So to claim an exemption, this is the questionnaire, this is what the whole thing looks like. We just have some tips for this. If someone doesn't know their case record number, we know lots of people don't know their case record number. You could put the social security number on there and they will look it up and attach it to the case whenever it's dropped off. And then, like I said, almost all of these can just be attested to self-attestation. You don't need any like someone else to collaborate that's what the situation is, unless the worker has access to information that contradicts their situation. If they're claiming that medical exemption, it's like the fourth question on there. That's when you would need to get the medical exemption form filled out. And we can go to the next slide. And this is what the medical exemption form looks like. It's just one page, which is very nice. It can be filled out by a wide variety of providers. They don't have to be someone that accepts Medicaid, but that's an option. Any provider that accepts Medicaid can fill it out, but they don't have to accept Medicaid to fill it out. Be a school counselor, social worker, psychologist, nurse practitioner, someone administrative from the doctor's office, anyone who can basically attest to that, yes, this person has this condition. And we also have the link for like federally qualified health centers there. We know a lot of people may not have insurance, and so they might need to go somewhere else. So that's also on this slide. Okay, go to the next slide. So I just want to reiterate how important exemptions are. Benefits are safe for the full recertification period. For many folks, that will be a full year. So even if, say, I have a back injury and I can't work for the next 8 weeks, and that's my exemption, it counts for the whole year, even though that exemption ends. If I have a 13-year-old, uh, or I have a 14-year-old in my house and then he turned 15 halfway through my recertification period, I'm exempt until the end of the certification period. So that is really just important. Uh, that's why exemptions are so important. So even if someone's working or they're job searching, they think they're going to have a job soon. If they have another exemption, getting that is really important because if something happens to their job, their hours get cut, or they're not able to land a job as quickly as I thought they would, claiming that exemption is going to help them keep their benefits. And like I said, most exemptions only need to be verified if questionable. So an example of that would be, say, someone saying that they're homeless, but they've been using the same mailing address and it's like a regular residential address for the last 3 years. They might need the person whose home that is to put something in writing that says they don't actually live here. I just let them get their mail here and they've been couch surfing. So that's an example of when they might need something verified if it's questionable. All right. And then we can go to the next slide. And then I'm just going to talk a little bit about what notices folks get. So when someone is approved for SNAP benefits, they get this letter. It has their name on it. It says how much they're approved for and for what time period. And then right below that, there's this big chunk of text if there's someone in the household who is time limited, and it will say the name who's time limited and then like when their benefits will stop. So this is something that's included on the initial approval letter when someone is approved for benefits. And we can go to the next slide. And then sometimes they'll send this out separately. Sometimes it's included in that packet that people get when they're approved. There's a notice that's about all of the SNAP work rules. There's another set of rules that is called the work registration rules that generally don't impact people directly, but they're related to these rules. And it's confusing, but they might have something that gets this on here that's like, these are the work rules that you need to follow to get SNAP benefits. And in this, it will also list who's time limited and the exemption and how they can meet the time limit. All right. Then we can go to the next slide, and I'm going to switch it over to Louise.
Great, thanks so much. I'm just hitting send on a question in the Q&A. So complying, as Anne emphasized, exemptions are always best, but some people won't be exempt. And if the way to keep your SNAP is through compliance, there are these options of working for 20 hours a week, including unpaid work. Job training for 20 hours a week, some combination of work and training for 20 hours a week, or volunteering, which has separate sets of rules. Next slide, please. We're going to go over each of these in turn. So complying, again, it's 20 hours a week or 80 hours a month on average. Remember, as Anne said, there's this weird but good rule that you're exempt if you're earning $217.50 a week. And that exemption means you're good for a year. Compliance is only good for a month at a time. So if you're earning $217.50, then you want to make sure that the county assistance office knows that and codes you as exempt. But if you're earning less than that, work counts, even if it's unpaid, if it's self-employed, if it's in kind, like if you're working in exchange for rent, if you're doing an unpaid internship, if you're volunteering with a faith-based organization, that can be unpaid work. Or childcare for a family member or a neighbor, that's unpaid work. This can be combined with a training if need be, or paid work to get to 20 hours a week. Next slide, please. So here's a couple examples. We've got Rashid, who's driving for Uber, but also caring for his nieces and nephews after school for his sister for free. So he can add up the hours with Uber and get a letter from his sister showing how many hours a week he's watching the kids to get up to 20 or more. Similarly, we've got Jessica, who's working in retail at minimum wage, less than 20 hours a week, but she's also volunteering at her local library. And she could have her pay stubs plus a letter from the library or this community service form we're going to look at in a sec, documenting her hours of volunteering. Next slide. So that's work. Training. If you are in a training program, 20 hours a week, that counts. Or if you're in a training program less than 20 hours a week, those hours count in conjunction with maybe work or unpaid work. Pennsylvania's Department of Human Services has SNAP employment and training programs. So there's a map that's linked here, and you'll all get the slides. Or folks can talk to their county assistance office and say, I want to go to a program to help me find a job, or to help me improve my skills. There aren't infinite numbers of these slots, but we are hearing that there are still slots available for people. And if people go to one of these programs, the county assistance office can pay for transportation, childcare, although if you're caring for a child who needs care, you probably are not a mandatory work requirements probably don't apply to you. You're probably exempt, but you could still volunteer and get childcare if you wanted, and other supportive services are available. Next slide. Now, community service is a little different because this doesn't have to be 80 hours a week. Community service is volunteering with a nonprofit organization. And the number of hours you have to do is the amount of your SNAP grant divided by the minimum wage, which is sadly still $7.25 an hour here in Pennsylvania. So if somebody's getting the maximum SNAP grant for a single person of $298 a month, you divide that by $7.25, you get 41 hours a month. So that's better than the 80. You can't combine this with other activities, though. And there's a form we're going to show you in just a sec of where that the nonprofit could sign to document your hours. And there is a program that PADHS has set up called PA Navigate to help people find volunteer activities. Next slide. So this is the form that hypothetically the library, the church, whatever nonprofit somebody is volunteering at would have this nonprofit fill this out. And that's good for 6 months. So once somebody has filled out this form and submitted it to the county assistance office, they should not need to verify their volunteer hours for another 6 months. The way that works is the nonprofit is agreeing to let the county assistance office know if the person stops showing up. That's in the fine print on this form. Next slide. So if somebody isn't complying or isn't exempt, what happens? If you aren't exempt and you're coded as compliant, but you lose your job or you stop volunteering, you're required to report that to the county assistance office right away, and they will start counting months. You've got 3 months of SNAP that you can get in a 3-year period when you are neither exempt nor complying. So if you're neither, your clock is running. And as Anne mentioned, that 3-year period, it's the same for everyone. It's not a 3-year period for each individual. Our current one expires at the end of this year. And then in January, even if people are still not exempt and still not complying, folks can get at least another 3 months. And certainly before then, if people are exempt or complying, they can reapply at any time and get their SNAP back. Next slide. So what happens? How do you get cut off? If it's just you in the household, what they're going to do is give you SNAP for 3 months at a time. And basically a month and a half in, you're going to get a renewal form, so that they will automatically close your case after 3 months of non-compliance, unless you fill out that renewal form and show as part of the renewal that you are exempt or complying. But a lot of our clients have no idea what this is about. They get the renewal form and they fill it out and struggle, but they haven't been sort of clearly told the reason why you're getting this renewal so soon is because we think that you are not complying with or exempt from the work requirements. For people who are in a household with other folks who are still eligible for SNAP, so I'm getting SNAP with my 66-year-old mom, and she's not subject to the work requirements, or I'm getting SNAP with my 30-year-old daughter who is exempt. Those people will continue to get SNAP, but if I'm neither exempt nor compliant, I will be cut off SNAP. So the county assistance office will send a notice saying Louise is not eligible for SNAP anymore. Her mom or her daughter, whoever else was getting SNAP with her, will continue to get SNAP, but they'll get less. It'll go from a household of, say, 2 to a household of 1. And those other people will not get renewals every 3 months. They will continue to get renewals once a year. So that will be a termination notice, which is different from the households of 1 who are getting these renewal forms. Next slide. So getting back on, if your benefits closed at renewal, get that renewal form in if you didn't, or reapply if you are eligible. So reapply and do the interview and explain why you are exempt or complying. And you can do that at any time. You can reapply. But if you just got cut off, submitting that renewal form will be a little easier than reapplying. If your benefits got closed for just you and the rest of the household continues to get SNAP, you'll get a cutoff notice. And with that one, if you appeal within 15 days of the date of the notice, your benefits continue while you wait for a hearing, which would be about 2 months from now. So that's an opportunity to act fast, keep the SNAP on, and then during those months when you're waiting for a hearing, work with the county assistance office to show that you're exempt or complying and still eligible for SNAP. If you miss those 15 days, you could still appeal, but you might also just want to reapply. And again, that's a way of showing them I'm still eligible because I'm exempt, or maybe I'm complying. Next slide. So recap on dealing with the county assistance office, and I should put in a plug here. Next month, we're going to have this Benefits Access Coalition, which sponsored this training, is having a training on dealing with the county assistance office. And so there'll be a webinar on that. We're about to show you shortly a link for how to register for that. But for now, advice for keeping your SNAP: check your mail and read things from Department of Human Services. If you have a smartphone or access to the internet, use My Compass, their online system, to report changes, complete renewals, upload documents. Use that exemption form that Anne showed you. This is actually, just as a hint, Community Legal Services has that form on our website, and people can sort of, it asks all the questions on the form, and then when you hit send or complete, you'll get a PDF of that form that you could upload through Compass or drop off at the county assistance office to report those exemptions. If you don't meet any of the exemptions, ask about employment or training options or community service to comply with the work requirements. If your benefits are stopped before renewal, appeal right away. If your benefits are stopped at your renewal, turn in your renewal packet or reapply right away. Next slide. So I think we had a pause here for some questions before we have a bunch of lessons learned slides here. But Mackenzie, are there some questions we should be answering live now before we move on to lessons learned?
I think I've got them in the chat. If any come up at the end, I'll let you know.
Okay, great. Then let's, well done. Thank you, Mackenzie, for answering them all. Then let's move on to lessons learned. Next slide. So as I mentioned, a lot of people will not know about the work requirement. This is something that we have seen over and over again here at Community Legal Services. People snap us off and they don't know why. So the more messengers, the better. I do think that this is going to be true for medical assistants as well. And the medical assistance rules are going to be more complicated. And so having messengers, sharing information with their networks, having flyers, exemption screening questionnaires, medical exemption forms accessible to everybody who's going to need them is something that's going to be really valuable. I should just mention, we haven't expressly said this, the medical assistance work requirements are scheduled to start in January, but it will be a slow rollout for people who are already on medical assistance. It will be happening at their next renewal, although people who are applying for the first time in January will be subject to the work requirements then. The best thing that nonprofits who want to help can do is to screen people for exemptions or for compliance and help with renewals and paperwork. A lot of nonprofits, sort of their first impulse is, oh, we can set up volunteer opportunities, and that is valuable, but not as valuable as educating yourself so that you can help people be screened for exemptions and claim exemptions so that they can keep their SNAP for a year. Again, the compliance is good just for that individual month. People have to keep doing it month after month. I think it's going to be hard for a lot of people to be volunteering 20 hours a week, week in and week out, just to keep their benefits, whereas an exemption is good for a year. And again, emphasize exemptions first. For SNAP, many, if not most, people should be exempt. A lot of people have medical conditions that reduce their ability to work. People have depression and anxiety or pain or fatigue. These are conditions that reduce their ability to work, and a lot of people should fit into those. A lot of people are caregiving for family members. That's an exemption. Certainly a lot of people are earning $217.50 or more a week. So help people claim those exemptions. This is a work reporting requirement. That's often, it's the reporting that trips people up more than the work itself. Next slide. Another lesson learned, cutoffs happen at renewals. But people don't necessarily know that the cutoff was because of the work requirement, as opposed to the renewal process, which has been tripping people up for decades. So help people figure out what happened with their paperwork, and if they are subject to a work requirement, make sure that in addition to the usual renewal form, people are reporting their exemption or their compliance information as part of their renewal. Next slide. So currently, Compass, which is the online application, does not currently ask about all exemptions, which is unfortunate. We do think Compass is going to be tweaked for the medical assistance work requirements, but there is a section in the Compass application or on the paper application where people can add notes and report an exemption. I am pregnant. I am caring for my disabled grandmother. I am applying for unemployment. So that you can claim those exemptions, or as I say, create that exemption form that you could get on CLS's website or DHS's website, submit that with the application so that the caseworker knows which exemptions apply to you. The county assistant, another lesson, a county assistant's office is going to make mistakes. They do not have enough staff. They especially don't have enough clerical staff to attach papers that are submitted to the county assistant's office or that are uploaded to Compass, attach them to a person's case so that the worker can see them. So what we see, unfortunately, too frequently is people get cut off, even though they have already submitted the paperwork to the county assistant's office, but the caseworker couldn't see that paperwork because it hadn't been attached to the file. So be vigilant, be prepared to push back, be prepared to appeal denials. If folks are in Philadelphia, send them to Community Legal Services, or if you're in the rest of the state, there are legal services programs all over the state to help people fix mistakes. Or you all attend the webinar that's on, I think it's August 12th, that will help you all to improve your skills to get the county assistant's office to fix mistakes. And I did see that there was a question about SNAP, people who are getting both SNAP and medical assistance, and how those rules, work requirements are going to work together. It's going to be very confusing because while many of the exemptions are similar, like if you are pregnant, that's an exemption for both. So some exemptions apply to both, but not all. And in particular, the medical exemption is still being worked out. But being medically exempt for SNAP will not necessarily make you medically exempt for Medicaid. It will work the other way around. If you're medically exempt for Medicaid, you'll be medically exempt for SNAP. We are having a webinar in September about the Medicaid work requirements, when hopefully we will have more answers to some of these questions. And we will talk more about the intersection between the SNAP and Medicaid work requirements then. But for now, just to note that even if you are exempt for SNAP, but subject to the Medicaid work requirements, you could volunteer for SNAP employment and training programs to meet as a way of meeting the Medicaid work requirement if need be. Next slide. So as I've mentioned, on August 12th, we're having a best practices for assisting folks with the county assistant's office. And there's a link that we'll be sending out, and I think Mackenzie will put in the chat for registering for that webinar. And then on September 16th, we're going to have one on Medicaid work requirement rules. We don't yet have a link to register for that, but we do have this link through FAN, the PA Health Access Network, to sign up for what we call our Benefits Access Coalition. That's the sort of umbrella group that CLS and Just Harvest and FAN and some others are part of, that will be sponsoring these webinars and updates. And if you want to get the invitation to the webinar on September 16th on Medicaid work requirement rules, be sure you sign up with this link to get the Benefits Access Coalition emails. And next slide, I think we may be done. So questions?
There are a couple of questions in the chat, Louise, and including one that I think Anne has already answered, but might be a point of confusion for folks still. I know it usually is in these presentations. Someone asking to clarify the difference between exempt and compliant and sort of why that matters. I think that might be worth reiterating here if possible.
I can answer that, although Anne, jump in. So exempt means the work rules don't apply to you. And that's better than compliant because under the rules, if you are exempt, you are good until your next renewal, which is likely a year from now. Compliant means you are doing those 20 hours a week of work or training, or a combination of work or training, or doing the community service for the required number of hours. So, and compliance you have to do every month. And if you're not compliant, then you start running that 3 month time limit. So this is why we've put so much emphasis on exemptions, is if you are exempt, then you're good until your next renewal, even if the reason for your exemption ends.
Someone else asked, and Anne is just beating me to it, but again, maybe good to share with the bigger group. And the budget that was just passed, the state budget, did that include money to implement these changes and administration of these changes?
Anne, you going to answer?
Sure. So they included 93, maybe 94 $1 million for DHS. 7 million of that is to move the EBT cards to chipped cards, which are less susceptible to theft. And then the rest is just to backfill what was cut from the feds. So it's not going, it's like maintaining status quo. It's not adding on more. It's just backfilling what was cut from the administrative posture.
In general, there was no increase in county assistance office staff for SNAP or medical assistance. It's flat funded, which is worrisome because this is a lot more work.
I see that there's another question here, and this question was asked by someone else too. When a household size is dropped because someone in the household is not eligible. So yes, that does drop the maximum income. Oh, this is for Medicaid. Okay. You'll have to answer the Medicaid part. But for SNAP, if the household size is reduced, then the income threshold is also reduced. The maximum benefit is reduced. And this is really gross. If the ineligible household member is the person who, like, the rent is in their name, they then prorate that shelter expense. So like, if, you know, the rent's $1,200, they might only count, and there's like 4 people in the household and one of them's not eligible, that one parent whose name is on the rent, they will prorate it. And then only, you know, 3/4 of the rent expense is counted when they calculate the benefit amount. So that's how that works for SNAP. I don't know how that impacts the income threshold for Medicaid. Louise, do you know?
I think it's just going to work very differently for Medicaid. There's not going to be the same dropping of a household size for Medicaid. So that'll just be different. And we'll cover Medicaid in September.
Another question here, Louise, someone asking, they were under the impression that the exemption for someone experiencing homelessness had been removed, and just asking for clarity about that for SNAP work requirement.
It has not been removed. It's a little tricky. The federal government recognizes and has long done this for over a decade. People who are chronically homeless count as having a sort of essentially a medical exemption, and Pennsylvania is doing that. People who are not chronically homeless, Pennsylvania has been using what are called state discretionary exemptions to protect them. We are worried that Pennsylvania doesn't have enough of those discretionary exemptions, and it may have to change its policy, but it hasn't yet.
And I've gotten a couple of messages from folks in the Q&A that they can't click the links in the chat. So we will make sure to just send out all of the links that we've been mentioning and putting in the chat as a follow-up email along with this slide so that everyone has access to them. I'm sorry, I don't know why they're not working for attendees.
I saw briefly in the Q&A that there was a question about, are there entities that can help people screen for exemptions if an individual organization can't? And do you want to talk about the SNAP outreach grantees?
Yeah, so there are like 15 of us throughout the state that are contracted with the PA Department of Human Services to help people submit applications and do SNAP outreach and education. I can find the list of us and we can send it out with the follow-up. But yes, there are, I think almost everywhere in the state is covered now. So I'll send out that list along with who covers which counties. There are quite a few of us. So.
I see there's a question here. If multiple families live in the same house, can only one person apply for benefits? For example, if a senior mom lives with her adult daughter and the daughter's children, does the senior have to be included in the daughter's SNAP household, or can she apply separately? So this is a question that's independent of work rules. But for SNAP in general, the people who have to apply together are people who live together and who purchase and prepare food together, or essentially eat their meals together. So if a senior mom lives with her adult daughter and the daughter's children, then, and if they eat separately, they can be separate SNAP households. There's a couple exceptions here of what are called mandatory household members. So if this adult daughter is under age 22, there's a rule that says if you're under age 22 and living with your parent, then you have to be on the parent's grant, regardless of whether you eat together, which can be really harsh. And spouses who live together, even if they don't eat together, have to be on the same SNAP grant. But other than those exceptions, generally, if you don't eat with somebody that you live with, then you can be separate SNAP households.
A couple of other questions. Someone wondering if there's talk in the state government about allocating money to supplement the federal cuts. I think I know the answer to that, but I'll let the two of you or one of you answer that live. And someone else wondering about disaster SNAP. I'm not quite sure what the question is, but maybe wondering if that's a phase cut.
I'm thinking maybe you mean replacement SNAP if like there was we haven't had a national disaster declaration or operated a disaster SNAP program in Pennsylvania in a while. That there was like a huge natural disaster that might happen, but what you'll often hear about is replacement SNAP, like when a tornado comes through and knocks out the power for like 3/4 of the county for 4 days, or if just your personal, something happened on your block and your power was out, you can apply for replacement SNAP benefits for food that was lost during a power outage. And you have to do it within 10 days of the outage in the food. And CLS has a lovely flyer and with the form on the back that we use for that.
And it doesn't even have to be a power outage. It could be a flood, or they call it household misfortune. If something happens so that your food gets spoiled, you can get up to 1 month's worth of SNAP worth to replace food that was spoiled, if you request it within 10 days. This question, is there any talk about the state government allocating money to supplement the federal cuts? No. Sadly, as I say, there hasn't been money to increase the number of workers. It's a tough budget environment, and there has not been leadership and sort of political will to replace the federal cuts, other than there was money to replace the cut in federal administrative money for the program. Question here: when people get their benefits stolen, who can they reach out to because they're not replacing their benefits? I'm afraid it's emergency food system, food banks, pantries. They are not replacing benefits. This is what Anne said about there was money in the budget to put chips on cards is great news, because that's the way people's benefits are stolen, is because the cards that are being used now have decades old technology that's really insecure and easily stolen by international organized criminals, and putting the chips on the cards, which DHS hopes to do, and they said 6 to 8 months, will help a lot. A question here: can other organizations also get trained? Not sure what kind of training, but CLS is happy to do trainings. If you're in the Philadelphia area, reach out and let us know what kind of training you're looking at, you're interested in.
There's another question here that I don't know that we can answer totally straightforwardly, but someone's wondering what the data shows us since HR1 was implemented. For people who are losing SNAP, is it because they're not meeting work requirements or more for administrative reasons?
So DHS shared with us some data about who they think is losing benefits because of the work requirements, and it's about half of the people who have been disconnected from SNAP. So it's over 100,000 people were disconnected from SNAP because of the work requirements. So about half of what we're seeing. So the other half is likely a combination of the immigration rule changes and the administrative burden of the extra paperwork.
And just to be clear about that administrative burden, this is this payment error rate that Anne mentioned at the beginning, where the state is so fearful of having a payment error rate that's high enough to make the state have to pay hundreds of millions of dollars as its share of the cost of SNAP benefits. They're just requiring more paperwork and looking at every case more strictly and denying if they feel like, we might be making a mistake on this case, because there's no punishment really for them denying somebody inappropriately, but there is this huge consequence for making a mistake and issuing benefits. It's this really lopsided, I'd say unfair incentive system on the county assistance offices.
I think we've gotten through all of the questions. People have a couple more minutes to put them in the chat. Oh, okay. This is a question about Medicare. I'll answer this offline.
There were quite a few questions about college students and student rolls, and we didn't go over the student rolls in this presentation, but I think if that's something that people are interested and want to know more about, we could do a separate webinar about student rules. Because there were lots of questions about college internships and student eligibility.
And just as a quick summary about student eligibility, the rule is students in like college, post-secondary education, at least half-time, are ineligible unless they meet an exception. But there's a pretty long list of exceptions. If you're working 20 hours a week, if you've got young kids, if you have a medical condition, if you're receiving work study, of any number of hours a week. Those are all exceptions that make you eligible for SNAP. And essentially, if you're a college student who's eligible for SNAP, then you would be exempt from the work requirement rules because you'd be in school at least half time. So for, somebody asked where the exemption form is online. Go to clsphila.org /SNAP changes. This is our website for the SNAP work requirements and immigration changes, all of the HR1 changes. And we've got a screening, the screening form there. And I'm sorry that it seems like putting links in the chat isn't working. clsphila.org, clsphila.org /SNAP changes.
Okay, I think we've gotten to everything. And again, all of the links and everything we mentioned today will be sent out in a follow-up email with a recording from the webinar, all of the answers to these Q&As, and also possibly a transcript of the webinar if we can get it. I think that's all, unless anybody has anything else. Thank you to everyone for coming today.
Thank you.
Thanks, everyone.